Hello, my name is Courtney and I'm your child's nurse. I wanted to sit down with both of you today to go over your child's new diagnosis of croup. I know this all sounds very scary, but I assure you that this is a treatable condition and one that is quite common among children in your child's age group. Let me begin by explaining what croup is and the signs and symptoms to look for. Croup is an infection of the upper airway and is caused by a viral infection, most often parainfluenza. Croup causes swelling of the airways, making it more difficult to breathe. When your child breathes in, it may sound like a high-pitched whistling. This is called stridor. When your child coughs, it may sound like a seal barking due to the swollen and narrowed airways. Some signs and symptoms to look for are a loud bark-like cough, fever, hoarse voice, and noisy or labored breathing. Croup usually begins as a common cold and then worsens as the swelling and irritation of the airway persists. Symptoms tend to be worse at night and typically last no more than 3 to 5 days. However, you'll want to contact your provider if symptoms worsen or last longer than 5 days. Some examples of worsening symptoms or complications of croup are noisy or labored breathing when breathing in and out, drooling or difficulty swallowing, breaths at a faster rate, notable anxiousness or restlessness, difficulty breathing, and if you observe a blue or gray tint around the mucous membranes, such as your child's nose, mouth, and fingernails. Let's talk about how to treat croup. As I stated before, you can treat your child from home unless symptoms worsen. The provider has prescribed a corticosteroid called dexamethasone, which is an anti-inflammatory agent that will help to reduce the swelling in your child's airways. Side effects of this medication may be insomnia and increased appetite. Another medication your provider has prescribed is epinephrine in the form of a nebulizer breathing treatment. This medication is fast-acting and helps to reduce swelling in the airways as well. Side effects of epinephrine are anxiety, increased heart rate, and shaking. Besides these medications, you want to encourage your child to rest, push fluids. You can use a humidifier in your child's room. And if your child has a fever, you can give either Tylenol or Motrin as needed. I will also be sending home some information for you to look over as well. And I hope your child feels better soon. Thank you.